Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening and welcome to Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Washington Township, and Woodbury. We're here for the next half hour talking about general sports injuries. So if you've injured something over the holidays, or maybe you'll be injuring something tomorrow as you're shoveling all that snow, we urge you to watch for the next half hour. They say 4 to 8 certain places. We'll see. Our guest tonight to answer your questions, we have Dr. Anthony Valarie, who's an orthopedic surgeon with Tri-County Orthopedics with locations in Washington Township and Woodbury, and also a graduate of Michigan State. And to his right is Dave Anselmo, who's a physical therapist with Cross Keys Physical Therapy. Welcome to the program, gentlemen.
I'm not a graduate of Michigan State.
Not a Spartan, but honor us, if you will, with the anatomy of the knee.
Sure. This is a right knee. Let's start with the bones first. It's the femur, it's the top bone. The tibia is down here. This is the fibula. Get right over here. Okay, and behind here is a well-known patella. Right there. Now let's go ligaments. Inferior patella tendon, the superior patella tendon. This is the lateral collateral ligament. Go here medially. We get the medial collateral ligament. And let's go inside the knee. Here and look here. Push it down a little bit. This is the medial meniscus, the lateral meniscus. Once again, the medial meniscus, the lateral meniscus, and then we got the anterior cruciate ligament, which we'll be talking a little bit about tonight.
Okay.
As I turn the knee around, it's the posterior cruciate ligament right here. And that's the knee joint.
And before we go any further, I want to remind you that Cross Keys Physical Therapy Sports Medicine Center is offering free evaluations for the next 2 weeks, and at the end of the program we'll give you the number to take advantage of that offer. Again, they're in Sicklerville, Washington Township, and Woodbury. Dr. Anthony Valarie with us as well, and we always hear about ACLs. What is the ligament and why is it so important?
Well, you have a couple ligaments that stabilize your knee, whether you're playing sports or just getting around walking in the mall. Dave had already gone through basically 2 of them. You have 2 on the sides, the collaterals, and then down in the center of the knee, you've got your anterior and your posterior cruciate ligament. Now, those 2 ligaments help control the bottom part of your leg from shifting forward and back. When you go up and down stairs, for instance, you don't want people have feelings that their knee gives out on them. That can be because of a torn ACL. Now, it's important for athletes, football players, basketball players. They do a lot of cutting, pivoting, running in general. They need to have a stable knee. And it's not only for pain, but if you lose one of those ligaments and you don't have it addressed and you're physically active, you could be looking at premature wear and tear of the knee.
And is it one of these things where if you don't treat it, it gets worse?
If the ACL is torn, you mean?
Mm-hmm.
If the ACL is torn, it's torn. There's really nothing that's going to bring it back other than like some kind of reconstructive surgery or a special brace. But I think what kind of you might be touching on is the idea of it can get worse in that once you start down the path of an ACL tear and you have pain and swelling, sometimes that pain and swelling can continue, and then you start to get into this cycle of the more pain you have, the more unstable your knee feels. The more you protect it, the weaker it gets, and the weaker it actually, the weaker it gets, and the more it'll just keep giving out on you. And then that just starts you down the road of premature arthritis in the knee.
Okay, that's what sports, Dave, are we most likely to see problems with the ACL?
Well, like Dr. Valarie said, it's pretty much any activity or sport that which a foot is in the planted position and cutting is involved. And you see a lot of that in basketball, soccer, football, of course. You see a lot of real big football players hurt them. Lacrosse, or even sometimes even hockey, you see it.
Okay, so. Going to put our numbers up on the screen. We're talking general sports injuries tonight, so if you're having problems with your knee, your shoulder, your elbow, your ankle, whatever the case may be. Back 1-888-634-7488 is our number to get a hold of us live tonight. Also, a local number is 856-767-8884. If you're more comfortable typing your question out via email, you can email to us at wpsjtv@aol.com. What options, Dr. Valarie, are available to a patient after they torn the ACL?
Well, first thing you want to look at is their age, their activity level. What are they going to be doing with themselves? Whether they're physically active or they're in the the later years of their life. The best option for a young physically active person would be surgery to reconstruct that ligament. If they didn't want to go the route of surgery, probably the next best thing would be a special kind of custom molded ACL brace. And short of rehab. Rehab and exercise is always in there. You want to keep the muscles conditioned around the leg so as not to get it easily re-injured. I have people now. People can walk around with an ACL tear, and people can do perfectly fine most of their lives. It's not like you have to have it done. It's not like everybody that has a torn ACL is going to have pain. Most people, because they push their legs or their bodies to the limit, are going to show signs of giving out and instability. So those are the ones that are going to probably best benefit from an ACL reconstruction.
Okay, our toll-free number again is 1-888-634-7488 if you have questions tonight. General sports injuries are topic. First caller on the line is from Blackwood. Dennis, are you there?
I'm here.
Hi, Dennis. Welcome to Sports Doctor. Your question for our guest?
Yeah, I do. I just recently actually tore my ACL.
Mm-hmm.
The doctor told me that I have a 45% tear on my MCL, and I have a slight hairline fracture on the patella. Now, my question is that I guess part of it is intuitive, is that the doctor told me that they should wait until the patella heals and do physical therapy for 5 or 6 months and then address the ACL. My question is that I'm pretty active as a person. I'm 54, I play racquetball. I recently came in to see David. He did my physical therapy the other evening. And when you start talking to a lot of individuals, they seem to say the same thing, that if you're active, most people talk about having the surgery to repair the ACL. So that's my question, what do you think is the best procedure for me?
Okay, an active person with a torn ACL.
Well, let's break it down. The ACL, as long as your knee looks fine, I guess an MRI would be the best thing to show that, maybe an X-ray, short of an arthroscopy. But if your knee is fine otherwise, besides that ACL tear, and you're as physically active as you say, you should have it reconstructed. Now, like I said, we don't have to go guns blazing into the operating room to get it done right away. You can always pace this out. It's not an emergency. If you have a fracture around there, the patella fracture, go ahead, let it heal, especially if they're going to take that center. Sometimes we can harvest the center third of the patellar tendon, and we take a little bone block from the patella, a little from the tibia, and that's what we use for a graft. Now, if that's the intention of the surgeon to do that, then the last thing he's going to want to do is go taking out that piece of bone around your fractured patella. I mean, that might just break it even more and then really create a problem. So, like I said, let it heal. The medial collateral ligament, the MCL, that's fine. You don't need surgery for that unless you're Donovan McNabb or something. But those MCL sprains always heal. I would just say, yeah, go ahead, rehab it, take the time, make sure, it might even help you with the rehab after the ACL. You get your leg in tip-top shape, let the bone heal, go in and do the ACL reconstruction. Afterwards, it'll probably make the rehab post-operatively from that a lot easier.
Dennis, thank you for watching. Thank you for the call. Again, our toll-free number is 1-888-634-7488. General sports injuries tonight. You're watching Sports Doctor. Our next caller is from Cherry Hill. Welcome to the program. Harry, are you there? Harriet, I'm sorry. Is it Harriet?
Harriet, yes.
Harriet.
I can barely hear you.
I could barely hear you, too.
My question has to do with my husband who has a mallet finger.
A mallet finger? Who has the mallet finger?
My husband has a mallet finger.
Okay.
It was injured. It's his little pinky. And he has a lag in it. it happened actually 6 months ago. We've been to 2 hand specialists, and they keep telling him hand therapy, which he had, and he's still finding a lot of discomfort. He has a lag in that finger. He has some cartilage or whatever at the first joint, so it's difficult for him to bend it, and at times he bangs it inadvertently, which causes some pain. And I'm just wondering if there's anything else other than therapy that can be done for that.
What can be done for a mallet finger?
Well, a fresh mallet, I'll probably take this one, Dave. Go ahead. A fresh mallet finger, almost 100% of the times, doesn't need surgery. Mallet fingers, by the way, I don't know if you can say it here, but it's where just the tip of the finger, the tendon inserts right here, and you jam it. Most times people playing basketball or football, and they jam it against their finger, and there's an opposing force, and that tendon gets torn, and they get this kind of motion. Right. And that's the lag she's talking about. And no matter how hard somebody tries, they can't straighten their finger out. Now, again, it goes back to a fresh injury. There's a special kind of splint that holds it up, hyperextended, brings the tendon together, and they heal that way. Now, I've treated, and I'm not saying this is a general way of doing it, but I've treated people months out of this with the stack splint, and some of them do come around and they're able to get full straight extension to that finger. Therapy, you were talking about the cartilage injury, by the way, and I'm not sure if that was arthritis or what you meant by that, but the therapy is good in terms of strengthening it. Still have to let the tendon heal. Now, you say, well, okay, we've already gone around with that a couple times. There are surgeries that can reattach that tendon. I don't know if you would be trading one problem for another, though. In terms of him not being able to straighten it, he might not be able to bend it. And then you get into possible surgical complications of some tenderness and scar tissue around there. So I don't know if surgery is the answer. Like I said, I have had a couple people who've come to me 4 or 6 months after an injury where I place them in a stack splint just to kind of like keep it simple and see if it helps them. And it has. I don't know if he's tried that with them.
When would they wear that that splint at night or all day? Or?
All day, all night.
Okay. Harry, thank you for watching. Hope your husband does better with that. Toll free is our number, 1-888-634-7488. We're talking general sports injuries tonight. You're watching Sports Doctor, brought to you by Crosskeys Physical Therapy. They're offering free evaluations for the next 2 weeks. We'll give you the numbers for that at the end of the program. Right now, though, waiting to talk to us from Franklinville, we have Barbara on the line. Barbara, welcome to Sports Doctor.
Hi, how are you?
Good, how are you?
Okay. I was just calling my daughter. She's 10 years old, and she was diagnosed with Osgood-Schlatt's disease in the knees. Mm-hmm. Okay, and the only thing, she's in a lot of pain, and really, I don't know if there's anything more we can do besides they diagnosed her and told her to take ibuprofen.
Osgood-Schlatter disease?
Well, I guess for those other people out there who don't know what Osgood-Schlatt's or OSD is, it's a condition where, here we go, we'll go to the model. Your patellar tendon attaches right here to the bone. Now, unfortunately, for young kids that are growing, there's a growth plate that this tendon actually attaches to. Kids that are involved in a lot of sports, running sports, will sometimes put overstress on that tendon. It starts to pull away from the bone here, and it actually pulls that growth plate away. That's what Osgood-Schlatter is about. Part of what they were talking about in terms of resting and anti-inflammatories is right. And that's all you can do for it. It's a factor of inflammation and injury to the growth plate. So you have to let it calm down. You have to let the body heal it. It can be a condition that'll last for months, or it can be a condition that lasts for just several weeks. You rest, you go back to sports. It can always come back. One thing I always tell patients is I can guarantee them that when the growth plate closes and they're done being teenagers and all that, the pain will go away. But I don't think just rest and anti-inflammatories is the answer. There are special Osgood-Schlatter braces that can be fit with the patient, And I always put people through physical therapy because it's all connected up. Your patellar tendon to the bone, up to the quadriceps, into the thigh. So if the muscles are conditioned up here, that might take some of the load off of the tendon.
Can that lead to other conditions?
Not really. I mean, that's. I think there's different stages of Osgood-Schlatter's, and most of it is self-limiting. I think you only see the worst cases in these textbooks, but I guess technically you could overstress it so much that the growth plate actually rips up. Then we got to go in surgery and put a screw down there to hold it. That can lead to other problems, growth plate problems in the future.
Good strengthening program, like you said. I've seen very good results with it. So it's really good, but it's very painful. So I really feel for the child that has it.
10-year-old Osgood-Schlatter. Again, we're talking general sports injuries tonight. Toll free if you want to join our conversation. 1-888-634-7488. Joining us now from Hamilton, Bill. Welcome to Sports Doctor.
Hi, Doctor. How you doing tonight? I had a little problem with my son last night. He was in a high school wrestling match, and after the match was over, he was getting onto the bus, and his knee locked up in such a way that he had to be taken to the emergency room, where it took like 2 shots of morphine to get him calmed down. He couldn't get his pants off to get an X-ray.
Did he hurt it in wrestling?
He came home. They put his knee in some sort of a brace, and then went to the doctor today. He was very good, and he was able to unlock the. He said the meniscus is torn from the knee, and the knee was locked, and he just went in there and he actually popped it right back out. Now, you know, I certainly believe what the doctor said, because he's one of the best around. He's done for the season wrestling. He's done for a while, and he needs to have an operation on it. Is there anything that you might be able to add to it? You know,
how old is he?
He's 18.
Yeah, he needs surgery.
Did he hurt that while he was wrestling, or was it after the?
No. What he did was 2 weeks ago he had a minor injury in the meniscus area where the trainer. We have a trainer in our school. He took care of it, and he didn't wrestle for a little while, and then actually last night all he did was he turned around after the match. He wrestled actually last night, and he turned around on the back of the bus, and at that point he was in so much pain.
So it looks like surgery.
Well, first of all, when anybody complains, they come to me and they say, my knee locked. First I find out, well, was it locking or was it stiff? If it's locking, I mean, the first thing that pops into my mind is a meniscus tear. Probably the second thing would be like a flap of cartilage in there. Now the meniscus, we can go back for everybody here. The meniscus are these C-shaped structures on each side of the knee there. It's a shock absorber for the knee. It's a very soft cartilage, easy to tear.
He was twisting.
Right. It's wrestling, I'm sure that's the way he did it.
Yep.
But yeah, these things do not heal, and I would not wait for it to heal on its own.
No.
Now, he's of the age group where your body needs a good meniscus, an intact meniscus. So he's of the age group where if they did the arthroscopic surgery, he would have a good chance that meniscus is repairable. And there's ways we repair it with either little bioabsorbable darts or arrows or a suture to anchor it back in place. But you don't know until you get in there. Sometimes the MRI shows you, but you're not really sure. But he definitely needs surgery, and I wouldn't waste. Don't even think about any kind of sports until that's taken care of and it's healed.
Okay. Thank you for the call, Bill. Good luck to your son. Another call on the line from Sicklerville this time. Chris, welcome to Sports Doctor. Are you there?
Yes.
Chris, hi. How are you doing?
The question actually is for Dave. I saw Dave previously for a hamstring injury, but I injured my knee. I went to the doctor, and the doctor told me I had a partially torn meniscus. Is there anything I can do to help strengthen that knee?
Sure. Is this sushi, Chris, by any chance? Yeah, there's a lot of things you can do for that strengthening that knee. You got to really work on those quads, and I remember this guy, his hamstrings are so big, he really needs to stretch them hamstrings out as well. So there's a lot of things you could do to strengthen that up and to take a good balance between your hamstrings and your quads. But I remember this guy.
Thank you for watching. Thank you for the call. We are going to take a short break. We'll have more of your calls as we talk general sports injuries tonight. You can dial us up toll free at 1-888-634-7488. Locally, 856-767-8884. And we'll check our email questions too. WPSJTV@AOL.com. Again, it's Sports Doctor, brought to you by Cross Keys Physical Therapy. More on general sports injuries right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
Imagination. It may be the most precious of natural resources. To a child, playtime is a rehearsal for the real life they will one day inherit from us. How will they handle the challenges? What choices do they make? Who do they pretend to be? Love that part of your child that longs to daydream. Don't underestimate the power of play.
It's Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township. They're offering free evaluations for the next 2 weeks. If you're having any type of sports-related injury and you want to have someone look at it, we'll be happy to give you those numbers at the end of the program to take advantage of that offer. Right now, you can call us toll-free with your question about general sports injuries. 1-888-634-7488 is our toll-free number. We also have a local number at 856-767-8884. Email address, WPSJTV@AOL.com. To answer your questions tonight, we have Dave Anselmo, who's a physical therapist with Cross Keys Physical Therapy, and also Dr. Anthony Valarie, who's an orthopedic surgeon with Tri-County Orthopedics in Washington Township and Woodbury. We've been talking mostly about the knee tonight. Let's talk a little bit about the shoulder joint. And Dave, if you can walk us through the shoulder.
This is a right shoulder. Let's go through the bones as well. This is the humerus. This is the head of the humerus right here. This is the clavicle, better known as collarbone. This is the scapula right here. And here's some of the muscles or tendons that go into the rotator cuff, which we'll talk a little bit about, okay? This is supraspinatus right here. This is the tendon it attaches into. You got the subscapularis, which is right here. It comes in and attaches right here. This is the long head of the bicep. As we turn around, this is the infraspinatus right here, and then it comes and attaches right over here. And that's basically the shoulder.
The shoulder joint. General sports injuries, our topic tonight. Cross Keys Physical Therapy, bringing you Sports Doctor. On the line is Aaron from Belmar. Aaron, are you there?
Hello.
Hi, Aaron. How are you?
Hi, I have a basic question. When you're stretching your legs or stretching your arms, how do you know how far to take the stretch without hurting yourself? Because my boyfriend says if it doesn't hurt, it doesn't work.
If it doesn't hurt, it doesn't work.
Feel the burn, right?
That's not necessarily true. Well, you want to take it to the point where you do feel a stretch, and you want to take it to that point. Then when you start to feel a little bit of burn, that's okay actually, but you don't want to go much further than that. You don't want to. The most important things I tell people to do stretching, you want to do it slow and sustained. You don't want to do any type of bouncing. When you start to bounce with a stretch, that's when you have a tendency to tear the muscle or tendon. So taking it to the point where you feel the stretch, holding it for a good 10 to 15 seconds is a real good stretch. And if it burns a little bit, that's okay. The burning is a little bit of the blood flowing through that area, so that's okay. So never worry about the burning, but the bouncing is what you don't want to do.
Okay, some of our email questions have just been handed to me. Our first one is from JJ in Cherry Hill, who writes, I have a slightly torn meniscus. The surgeon wants to operate on it immediately. I got a second opinion, and this doctor wants to wait about 6 months to see if it will heal. What do you recommend? That's kind of a difficult question to answer without seeing the patient, I would imagine.
Yeah, that's an on-the-fence situation. I don't know if anybody could fault the surgeon for saying, yeah, let's go in and try and fix it with an arthroscopy. I guess it really would depend on how much pain is it giving you. If I saw a partially torn a meniscus on an MRI and the patient was doing absolutely fine, I'd probably just be like, you know what, let's see what happens over the next couple months with this. But if it's something that's it just keeps coming, the pain, and it just doesn't seem to be going away, then it might just be time to ask yourself, well, how long do I want to wait? How long do I want to be in pain to wait for this thing to possibly go away or possibly just get worse?
Okay, got some skiing questions as the weather begins to get snowy. Can you suggest some exercises to strengthen my knees and legs for a ski trip the second week of February?
Well, you really just don't want to not just strengthen it. You really, once again, especially with skiing, you want to work a little more with flexibility as well as strengthening, because there's a lot of absorbing need to be taken when you're skiing going down that mountain. So I recommend you to work on your hips and your back muscles and your abdominals as well as your lower extremities. But once again, an overall general strengthening program is good. Not just working on the lower extremities, but work on your abdominals and your backs as well.
Okay, Sal from Sewell writes, I would like to know, does tendonitis ever go away or can it flare back up? What if it is still there after 3 years? Is it permanent? Do I have to stop lifting? Tendonitis?
Well, yeah, tendonitis can go away. I mean, all tendonitis is just an irritation of the tendon, usually because of overuse or easy fatigue. You might be just trying to do too much in weightlifting. Conditioning, rest, anti-inflammatories, get it back in shape, it'll usually go away. Now, it can always come back again.
Exactly. You need to check out to see why he's having that tendonitis. Maybe it might be his faulty technique when he's lifting, or he might be overdoing one exercise over the other. So he really needs to get that examined, find out what he's doing there, what activity he's doing when he really feels it the most, and maybe he's overworking one muscle.
Sounds like someone that could take advantage of that free evaluation offer. And I'm going to give you those numbers right now. If you have a sports-related injury, you'd like to have someone look at it, Cross Keys Physical Therapy would like to help. You can take advantage of their free evaluation offer simply by calling the center nearest you. Sicklerville, it is 856-728-1900. Washington Township, it is 856-374-3707. In Woodbury, it's 856-853-0988. Use those numbers to schedule your appointment. Want to thank Dr. Anthony Valarie for being with us this evening. Again, he's with Tri-County Orthopedics in Washington Township and Woodbury. And of course, Dave Anselmo from Cross Keys Physical Therapy. Our next show is January 30th. We'll be with Dr. John Salvo from Hahnemann University Sports Medicine Center. Until then, I'm Joe Chapana for Cross Keys Physical Therapy. Stay well.